Hello there, welcome to StudyIQ. My name is Prashant Dhawan, and in this video we are going to review the Kurukshetra magazine. The theme of this month's Kurukshetra magazine is rural health. A lot of interesting topics are going to be discussed in this video, so hopefully you will watch it till the end. Before beginning the video, I would like to tell you guys about our pen drive and tablet courses. Our pen drive and tablet courses are available for all these exams that you see on your screen: SSC exams, bank exams, all government exams, UPSC exams as well. So to order our pen drive or tablet course, you can call these numbers that you see on the screen or simply visit our website studyiq.com. The first article is Towards a Healthier India, Immunizing Every Child. The article has been written by JP Nadda ji, who is the Union Minister of Health and Family Welfare. Make sure you remember that. Now, when I utter the word immunization, what comes to your mind? What's the first thing that comes to your mind? Immunization is the process whereby a person is made immune. That's why we use immune in the word immunization. So where a person is made immune or resistant to an infectious disease, typically by the administration of a vaccine. Now suppose there's a baby and we want to protect that baby from polio virus. So we can immunize that baby using a vaccine, a polio vaccine that is. So all we have to do is inject the polio vaccine in the baby's body, and the vaccine will stimulate the baby's immune system in such a way that it will become fortified. So we can say that immunization is the process by which an individual's immune system becomes fortified. The vaccine itself is not protecting the baby from the virus. It is its immune system, but earlier it wasn't ready for the virus, but now because of the vaccine, it is fortified and it can fight away the virus. This is how immunization works. Now, if we look at what World Health Organization says about this, over here it is written that immunization is a proven tool for controlling and eliminating life-threatening infectious diseases and is estimated to avert between 2 to 3 million deaths each year. So immunization is quite important. We shall discuss this, and I will also tell you the very interesting story behind the vaccine for the polio virus. Now if we look at the second point, this is directly from the magazine. Immunization is one of the most cost-effective public health interventions and largely responsible for reduction of mortality and morbidity rates caused by vaccine preventable diseases. Now why is it the most cost-effective public health interventions? Well, quite obviously because prevention is better than cure. Now suppose this unfortunate baby, had this baby been infected by the polio virus, it would have been a very costly affair to treat him of all the illnesses that come with the virus. But it will be much cheaper if we can immunize him, right? So this is why immunization is very cost effective, because prevention is better than cure. Well, the eradication of smallpox globally and the elimination of polio, yaws, I will tell you what yaws is later on, and maternal and neonatal tetanus from our country are clear reminders of the power of vaccination in dealing with the scourge of communicable diseases. Now all these diseases, whether it's polio or yaws, all these diseases are communicable. So what we have done is we have used vaccines to immunize our population so that they cannot get affected by these viruses. Now let's just look into polio a bit. In a lot of examinations, they tend to ask questions relating to polio. So let's cover polio and its vaccine. Now over here we have some very important notes that will help you in your UPSC preliminary examinations. People often get confused about some very simple facts, so I'll just clear everything over here. Is polio caused by a virus or a bacteria? It is caused by a virus. Never ever forget that. It's a very simple fact. Make sure that you remember it. Polio virus, alright. Secondly, the scientific name of polio is poliomyelitis, and it is caused by infection with a member of the genus enterovirus. Make sure you remember this as well, because whenever they will ask a question about polio virus, chances are they will mention this terminology. So you should know that it is associated with polio. Then, is polio virus a DNA virus or an RNA virus? Do you know that it is an RNA virus? Of course, I have written over here. I wonder, had I not written this over here, what would have been your answer anyway? So what does polio virus eventually lead to? It causes flaccid paralysis. it attacks the nervous system and then eventually lead to flaccid paralysis. Is there a cure for polio? Absolutely not. That is why polio's vaccine is so important. Only vaccine can prevent it. We can only prevent polio, we cannot cure it. Now there's a very beautiful and inspirational story behind the invention of the polio vaccine. Let me tell you about that. Now in India we have two types of vaccines. One is oral polio vaccine, OPV. Second one is inactivated polio vaccine. Both of them are very important. The inactivated polio vaccine is relatively new, and it will slowly fade out the OPV, but for the time being we have IPV and OPV both. Both of these vaccines are very important because they come under the Universal Immunization Program. More on this later. The Indradhanush program comes under the Universal Immunization Program. So we will discuss both of those important topics in depth later on. Now let me just ask you a very simple question. Suppose later on in your life you end up developing a very important medicine. You end up developing a medicine that can cure a very fatal illness. Now you have the choice of giving that medicine to the rest of the world for free, or you can sell it to a big pharmaceutical company for a huge price, and that pharmaceutical company will only sell that medicine, that cure, to the rich people. Which path will you choose? Which path do you think is morally correct? Now this is not a philosophy video, but still I will tell you what Dr. Jonas Salk did. You see, in 1953, American virologist Dr. Jonas Salk, he announced that he had developed world's first safe and effective polio vaccine. What Dr. Salk did was he basically heated the polio virus, and after heating the polio virus, the virus became dead. So he injected the dead virus inside of his body and later on exposed himself to the polio virus. And miraculously, the polio virus did not affect his body at all. His body had been immunized to the polio virus. Hence, he ended up developing a vaccine for the polio virus. At that time, it was a remarkable development. It was an amazing discovery by Dr. Jonas Salk, because for a very long time, polio had been public enemy number one. Well, first of all, it affected children, and parents would happily give up their own lives for their children. So it was very heartbreaking for families to see their children suffering from the polio virus and their limbs being crippled. So it was very traumatic for them to witness all that. Now, when the polio vaccine came out, you can pretty much see over here, this was a reaction in America. All the newspapers, they were celebrating the invention of the polio vaccine. Over here, you can see polio routed, polio vaccine is safe and effective, Salk's vaccine works. Over here, you can actually see some shopkeepers. They painted the front part of their shop to thank you, Dr. Salk. Now, you might be asking, all right, there have been many great inventions over the years. What's so special about Dr. Salk's invention? Remember the question I asked you about morality and whether you will sell your miracle cure for money or not? Well, Salk chose the morally righteous way out. He did not sell the polio vaccine. He did not patent the polio vaccine. Instead, he gave it to the American government for free, and later on, World Health Organization also got the polio vaccine for free. Now, this is a very important step because of this, a lot of developing countries that did not have a lot of money to spend on vaccines, they were able to afford Dr. Salk's vaccine because it was very cheap, because it had absolutely no patent. This is how polio's vaccine came into existence, because of one man who was above greed. And I think all of us can learn a lesson from Dr. Salk's story, that there are a few things that are above money. There's a very famous interview where Dr. Salk was asked, you could have earned so much money by selling the vaccine patent, why didn't you do that? And he answered, can you patent the sunlight? So what he was saying, that there are some things in life that should not be patented, that should not be sold for money. There are some things in life that belong to everyone, and medicine, cure, and I think vaccines are pretty much one of them. But apparently today's pharmaceutical companies, they don't really follow Salk's path anyway. So this is how the vaccine for polio came into existence. A very special story that you will probably remember for a very long time. Polio in India. In India, polio vaccination started in 1978 under the extended program on immunization. In 1984, it covered around 40% of the infants, and all of them were given an OPV, alright, oral polio vaccine. And later on in 1985, Universal Immunization Program came into existence. We will talk about that later on. Does polio still exist in India? Do we still have polio cases in India? Well, no, we don't. Not anymore. According to WHO, World Health Organization, according to WHO, in 2014, India became a polio-free country. You must remember that. All right. Is the entire world free of polio cases now? Well, almost the entire world except 3 countries. Those 3 countries are Afghanistan, Nigeria, and Pakistan. You guys have to type the capitals of these 3 countries in the comment box below. Now, some of you might be wondering, why is polio still prevalent in these 3 countries? Well, the reason behind it is that there are certain terror groups in Afghanistan and Pakistan that believe that polio vaccine is evil and it is a scheme to destroy the population of Afghanistan or Pakistan or whatever be the region. So in order to save the people from this so-called evil vaccine, they kill any NGO or government worker who is trying to set up any polio vaccination camp. So a lot of polio vaccination camp workers have been killed in Pakistan and Afghanistan because of this fear against vaccinations. So because of this, Pakistan, Afghanistan and Nigeria, there's a similar story in Nigeria as well. So because of this, polio cases still exist in Afghanistan, Nigeria and Pakistan. Other than that, India has also been declared free of yaws. Yaws is basically a chronic, disfiguring and debilitating childhood infectious disease caused by this bacterium. You don't really need to remember the name of this, just remember that India has been declared free of yaws by WHO. We will discuss WHO a bit later on as well. Other than that, tetanus occurs, India has also been declared free of tetanus, maternal and neonatal. And tetanus occurs when a bacterium, this one, enters the body through an open wound or a puncture. Now about yaws. Yaws is spread by direct contact with the fluid of an infected person. When I say fluid of an infected person, I mean when yaws affects a child, then that child sort of develops some lumps around the infected area, and the lumps eventually they produce some liquid. So if a person is in direct contact with those with that liquid, then the disease will spread. And the disease is most common among children who spread it by playing together. It is quite prevalent in many African countries, but India has been declared free of yaws now, which is a very good thing. Now we are going to talk about the Universal Immunization Program. Under this program, Mission Indradhanush was created. Now, Universal Immunization Program is a vaccination program launched by the Government of India in 1985. It became part of the Child Survival and Safe Motherhood Program in 1992 and is currently one of the key areas under National Rural Health Mission since 2005. Now, I think it was a very visionary decision by the Indian government to start the Universal Immunization Program in 1985. You might be asking why. What's so special about launching a immunization program, an immunization program? What's so special about that? Well, let me explain. The whole world does not exactly agree on the benefits of immunization. A lot of groups in USA, they believe that vaccines are not good for human beings in the long term, because they think that vaccines were not supposed to be a part of a human being's body since he was born. And their rationale is that for the time being they do give some comfort by protecting human beings against some certain diseases, but in the long run it will destroy generations. It will create a lot of problems for human beings. Now Donald J. Trump, the President of the United States, he has openly said this many times, that too many vaccines are bad for babies. He believes that if a baby is injected with too many vaccines, he might end up with autism. You might want to Google autism and you will find out that it is a very horrifying disease that any child can actually go through. So there are some groups that are very skeptical about the effectiveness of vaccines and immunization as a whole. So I think it was a very bold move by the Indian government to start a universal immunization program in 1985. A very, very bold move indeed. So the program now consists of 12 diseases. So the program now consists of vaccination for 12 diseases. Those 12 diseases are tuberculosis, diphtheria, pertussis, whooping cough, tetanus, polio, measles. Measles was in the news a lot recently in France, because there was a girl in France who got infected by measles virus, and later on she ended up spreading that disease to her friends. Now, a lot of newspaper articles in France, they argued why were her parents allowed to skip the measles vaccines, because by not immunizing them, they allowed their children to be affected by these horrible illnesses, and their children ended up spreading the disease as well. So in France now there are talks about making immunization mandatory for everyone. Other than that, there is also hepatitis B, diarrhea, Japanese encephalitis, rubella, pneumonia, pneumococcal diseases like meningitis. This is very much in the news. Make sure you remember meningitis. So these two, hepatitis B and meningitis, these two were added in UIP in 2007 and 2017 respectively. Now, under the Universal Immunization Program, Indradhanush mission came into existence. Indradhanush is basically a health mission of the Government of India. It was launched by Union Health Minister JP Nadda on 25th December 2014. Please make sure that you remember this. Alright, this is probably the most important thing that I'm going to tell you about Mission Indradhanush. The rest of the theory probably won't be of that much use to you now. So the government aims to give maximum protection to children against vaccine preventable diseases. Now, what are vaccine preventable diseases? These diseases are diseases that can be prevented through a vaccine. Now, for example, polio. Polio cannot be cured, but it can be prevented through a vaccine. So it is a vaccine preventable disease. Hence, government has launched Mission Indradhanush and it aims to immunize around, well, it's not all that important. Basically, Mission Indradhanush has 3 phases: Phase 1, Phase 2 and Phase 3. Phase 1 was launched on 25th December 2014. This was also Good Governance Day. Alright, and the aim of Mission Indradhanush is to expand immunization coverage to all children across India by 2020, to achieve full immunization coverage for all children by 2020 through catch-up campaign. Now, what is catch-up campaign? A lot of children have not been immunized over the years due to various reasons. So there will be a catch-up campaign as well, where children who have not been immunized yet, they will be immunized so that no one is left behind. That is the intention of the government. Now let's study Indradhanush a little more. Now, under Mission Indradhanush, the diseases that will be targeted are diphtheria, whooping cough, tetanus, polio, as we discussed earlier, tuberculosis, measles, hepatitis B. Now, these are 7 diseases. Later on, 4 more were added. So now there are 11 diseases under Mission Indradhanush that are being targeted. And in 2016, 4 new additions were made, namely rubella, Japanese encephalitis, injectable polio vaccine, and rotavirus was in the news a lot. Alright, and 201 districts will be covered in the first phase. Now let's just discuss WHO a bit as well, since we have been quoting WHO's rankings data for a very long time now. So WHO is an agency of United Nations. It was established on 7th April 1948. It's headquartered in Geneva, Switzerland. Alright. Now, WHO, as I told you earlier, is a specialized agency of United Nations. Alright. The predecessor of WHO was Health Organization. This was an agency of League of Nations. League of Nations, as you probably know, ended, and then United Nations came into existence because League of Nations failed to prevent World War II. Now, since the creation of WHO, it has played a leading role in the eradication of smallpox. Now, later on I will ask you a question. You can cite this example over there if you want to. And the Director General of WHO is Tedros Adhanom, who started his 5-year term on 1st July 2017. Please make sure that you remember it. Now you guys are supposed to write a note on India's participation in WHO's activities. Over here you can write a lot of things. You can write how India has carried forward WHO's initiatives like the WASH initiative. I will elaborate what is WASH later on extensively. I will discuss this in depth. So you can just use some of the points over there to create your note. Other than that, you can also write something about how WHO has been instrumental in addressing various health issues around the world. Well, while you are writing this, I suggest that you mention smallpox, Ebola crisis, and you can also write a little bit about India's polio campaign, how WHO played a positive part in that. Do a little research yourself. Self-study is best study, and make sure to write a good answer in the comment box below. Let's talk about safe drinking water over here, then we will discuss what is WASH. Over the years, several millions have suffered from multiple episodes of diarrhea and still fall on the account of hepatitis A, enteric fever, intestinal worms. This is the worst thing that can happen to a human being. And eye, there are some worms that affect the eye, skin infections caused by poor hygiene and unsafe drinking water. So water plays a very important role in our health as well. Access to clean water, sanitation and hygiene are essential elements in achieving a basic standard of health. There are sustainable evidence in the literature which indicate that interventions in the form of improved water supply, sanitation and hygiene came up with significantly improved health outcomes. Now I'm just reading this straight from the magazine. As you can pretty much tell, it's a good line. You can use this in your essay if you want to. Now, how bad is the situation in India? Do we have treated water supply in rural India? Well, the situation is so bad that you might be surprised in a very bad way. Only 18%, and that is restricted to a few states only. We are just talking about a few states only of the rural households in India have treated water supply. So you can now understand how bad the situation is. Now, there is a huge interstate variation in this as well. For example, in Bihar, Assam, basically the whole eastern belt, in Bihar, Assam, Jharkhand, West Bengal and Odisha, the percentage of rural households getting a treated water tap within the premises are 2% in Bihar, 4% in Assam, 5% in Jharkhand, 6% in West Bengal and 6% in Odisha. So now you can understand why so many people in rural India are falling ill and why diarrhea is such a horrific disease in rural India that takes away lives of many infants. So now let's talk about WASH. How does WASH help in this situation? Then we have WASH over here. WASH stands for water, sanitation and hygiene. I'm sure some of you must have noticed that two of these important aspects of WASH, they are also part of the Swachh Bharat campaign. So you can say that WHO's Swachh Bharat campaign is being WHO's WASH campaign is being assisted by India's Swachh Bharat campaign. So this is how India is assisting WHO and their initiatives. So over here it is written that UN Sustainable Development Goals SDG recognize WASH and health as important areas to be targeted. Alright, especially Goal 6, ensure availability and sustainable management of water and sanitation for all. It talks about achieving universal and equitable access to safe and affordable drinking water for all, reduction of pollution, increasing water use efficiency, source protection and participation of local communities in improving water and sanitation management. Swachh Bharat campaign, as I mentioned earlier, it is written over here as well. So I have been vindicated even though I was not contradicted. So Swachh Bharat campaign needs a special mention as it targets the most critical challenges of sanitation in rural areas. For the success of sustainable Swachh Bharat Mission, actually SBM, Swachh Bharat Mission, it is essential to work towards analyzing the status of toilets and mapping people's behavior for understanding the indigenous problems and not generalize it country-wise. Now this is a very important part that we shall discuss in depth. WASH. WASH stands for water, sanitation and hygiene. Some other acronyms are WATSAN, WASH, WISH. Alright, so it doesn't really concern us all that much anyway. So access to WASH, in particular safe water supply, adequate sanitation and proper hygiene education can reduce illnesses and death and also impact poverty reduction in socio-economic development. Now you might be asking, isn't that a bit far-fetched? It can impact poverty reduction and also socio-economic development. How can WASH be so effective? Please tell us, sir. Well, look, the lack of sanitation contributes to approximately 7 lakh child deaths every single year around the world due to diarrhea and chronic diarrhea. This can have a negative impact on child development. So what I'm saying is that, of course, this figure over here, that 7 lakh children die every year around the world because of diarrhea, it is absolutely horrifying. Now, of course, this figure over here of 7 lakh child deaths is very depressing itself. But the children who manage to survive chronic diarrhea and somehow manage to stay alive, they have a very negative effect on the child development, on their development that is. both physical and cognitive. That means that physically, of course, they can't really develop as other kids who are given safe drinking water, sanitation and hygiene. Other than that, their mental ability is very much affected as well. So in addition, lack of wash facilities can prevent students from attending school because of course they will be sick, and impose a burden on women and diminish productivity. Now how will it diminish productivity? Now just imagine there's a poor household where a child is ill because of chronic diarrhea. Now of course the mother probably won't be able to go to work now, will she? She will have to stay at home to take care of her child. So we are witnessing a diminished productivity and imposed burden on the mother, and of course the child is going through a horrific condition as well. And if he manages to survive, he will have a negative impact on his development. So wash is very necessary in order to curb all these evils. The United Nations International Year of Sanitation in 2008, please make sure that you remember that 2008 was United Nations International Year of Sanitation, has helped to increase attention for funding of sanitation in wash programs. Now over here, Bill Gates and his wife Melinda Gates, they have their own charitable foundation called the Gates. They donated a lot of money to the wash programs. Since then, these wash programs around the world have been quite successful because they are funded adequately and they have eventually managed to make a difference. What are the challenges of WASH? Part of the reason for slow progress in sanitation may be due to urbanization or poverty, as poverty is increasingly concentrated in urban areas. On 19 November 2014, United Nations Secretary urged that it is a moral imperative to end open defecation to ensure women and girls are not at risk of assault and rape simply because they lack sanitation facility. Now, this is a direct cutout from the Kurukshetra magazine. Over here, we are going to talk about open defecation now. Now, as you can see over here, United Nations General Secretary, he urged that we must end open defecation so that we can ensure women and girls' safety. Now, how is open defecation related to women's and girls' safety? Well, what usually happens is that the male members of a family, they usually defecate near the house, whereas the women have to go a little far. Because of that, at times they are attacked when they are traveling alone or when they are defecating in the open. So it is a very sad state of affairs. So of course, if we manage to end open defecation, we will achieve a lot of things in terms of health, in terms of sanitation, in terms of hygiene, in terms of wash overall. But we can also help in reducing assaults on women and children, something that India certainly is not famous for. This is because 1 out of 3 women worldwide lacks access to safe toilets. Alright. On the same day, UN vowed to eliminate open defecation from globe before 2025. You can write this statement in an essay or something if you want to. Now, open defecation is a major cause of fatal diarrhea. Now, let me read out the rest of the part from the magazine over here. Sorry, can't really add the entire thing. So, open defecation is a major cause of fatal diarrhea. Every day, around 2,000 children aged less than 5 succumb to diarrhea, and every 40 seconds, a life is lost. Let me just make notes out of the rest of the article. I think this can be quite useful for you guys. Now over here, I've made some notes that this will help you in your examinations, I guess. So open defecation is a major cause for fatal diarrhea. As I told you, every day 2,000 children aged less than 5 succumb to diarrhea around the world. Alright, this is not, this doesn't really happen in India. And every 40 seconds, a life is lost because of fatal diarrhea. That usually is a result of open defecation. Now, according to UNICEF, India, with more than 700 million people defecating in the open, which is an enormous number, accounts for 90% of the people in South Asia. So, of all the people who defecate open in South Asia, 90% of them are in India. And there are around 1.1 billion people around the world who defecate in the open. Out of that, 60% are from India. So, you can pretty much see that the problem of open defecation is solved in India. It will have a huge impact on these statistics worldwide. Another joint survey by WHO and UNICEF indicates that close to 400 million out of the 700 million people in India who practice open defecation despite having latrines available. So you can pretty much see that majority of the people, out of the 700 million people who defecate in the open, they do have latrines, they do have toilets, yet they choose to defecate in the open. So we must focus on the individual behaviors as well. It's not just about funding, it's not just about how hard the government is working, how much the NGOs are working. At some point of time, we have to change the behavior of the individual so that he knows what are the disadvantages of defecating in the open, and of course what are the advantages of using a toilet. Now there are a few flagship missions of the government of India which are targeted to improve WASH and health services in rural India. Now, as I told you earlier, WASH is a WHO program. So as you can pretty much see, India has also tried to take forward the initiatives of WHO through its own schemes, through its own flagship missions. So here is a list of all of them. First of all, let's talk about National Rural Drinking Water Program. This was started in 2009. This is under the Ministry of Drinking Water and Sanitation. So it is written over here, the goal of this mission is to provide every rural person with adequate safe water for drinking, cooking and other domestic basic needs on a sustainable basis. Now when we talk about clean water, we usually think about drinking water, but we tend to forget that water is used in a lot of aspects of a domestic life. So under this program, all these different aspects of life where water is consumed, cooking, drinking, cleaning yourself or brushing teeth, all these small things, we need to think about them before we start providing people the access to water. We need to make sure that the water is good enough so that it can be used for all the other purposes as well. Then there is a National Rural Health Mission. Well, the mission is, this is a mission to set up a fully functional community-owned decentralized healthcare delivery system in the country with its focus to ensure simultaneous action on an extensive range of determinants of health such as water, sanitation, education, nutrition and so on. Then you have a National Rural Drinking Water Quality Monitoring. Now this is very important. Because water sanitation matters a lot. Now under this program, there was supposed to be a community-based program. This was supposed to be a community-based program to ensure good quality of public water supply to rural people through decentralized water quality monitoring systems. Then there is of course the Swachh Bharat Mission Gramin that started in 2014. This mission aims to improve the general quality of life in the rural areas by promoting cleanliness, hygiene and eliminating open defecation. Alright, Swachh Bharat Gramin. Then the provision of urban amenities in rural areas, PURA, that started in 2003 under the Ministry of Rural Development. Under this scheme, amenities like water and sewage and drainage were proposed to be made available to rural areas. Alright, make sure you remember this, PURA. Then we have National Rurban Mission. Yes, this is not a typing mistake. It is genuinely a National Rurban Mission because it focuses on areas that neither belong to the urban sector nor the urban areas nor the rural areas. Alright, so this scheme aims to provide basic amenities like piped water supply, solid and liquid waste management and drains in urban clusters. Alright, so later on they mention UN Sustainable Development Goals again that recognize WASH and health as important areas to be targeted, especially Goal 6, ensure availability of sustainable management of water and sanitation to all. It talks about achieving universal and equitable access to safe and affordable drinking water for all, reduce pollution, increasing water use efficiency, source protection and participation of local communities in improving water and sanitation management. Swachh Bharat Mission needs a special mention as it targets the most critical challenge of sanitation in rural areas. For the success of Swachh Bharat Mission, it is essential to work towards analyzing the status of toilets and mapping India's behavior for understanding the indigenous problems and not generate it countrywide. Now over here, how are we supposed to understand the behavioral problem? We are supposed to understand it through surveys, of course, for understanding the behavior of the individual, why people aren't using the toilets even after they are available. a survey could be conducted by agencies such as Census Department, NSSO, National Rural Health Mission, Department of Water Supply and Sanitation, or Sarva Shiksha Abhiyan. This way we can actually find out what is the real problem. Why aren't people defecating? Why are people still defecating in the open even though they have been provided by latrines? So it's going to be a long process, because it seems to be more of a it seems to be a deeper problem than it was earlier anticipated. Now let's talk about healthcare in this year's union budget. The budget estimates for health show an appreciable increase of more than 27%. Now you don't really need to remember these figures over here, just remember there has been a spike of 27%. And now this will help attend tertiary care, human resources and health and medical education, and to strengthen National Health Mission. So the Health Ministry has spent 73.25% of this budget already, and the ministry will also create 5,000 postgraduate seats per annum to ensure adequate availability of specialist doctors to strengthen secondary and tertiary levels of healthcare. Now you must have wondered, since India produces so many engineers and so many doctors every single year, yet whenever we go to a government hospitals, there are really long lines over there, really long queues, and a lot of people, they don't even get access to proper healthcare because of this. What is the reason behind it? Well, it is because of lack of specialists in India. We don't have proper specialists, and whenever we do produce proper specialists, they usually tend to go abroad. So there's a lot of brain drain happening there. So if we invest a little bit more on medical education, perhaps we can fill this gap. So the ministry, as I told you earlier, the ministry will also create 5,000 postgraduate seats per annum to ensure adequate availability of specialist doctors to strengthen secondary and tertiary level of healthcare. Furthermore, 2 new aims will be set up in Jharkhand and Gujarat. Now again, it's a nice idea to open 2 new aims, but you need proper specialist doctors to fill in the important seats, so that those 2 new aims don't become congested like the one in Delhi as well. So the government has prepared an action plan to eliminate Kala Azar as well. Make sure you remember that, by 2017, and they plan to eliminate leprosy by 2018, measles by 2020. Measles was in the news a lot because of the French incident that I told you about earlier, and they also plan to eliminate tuberculosis by 2025, which will be a very daunting task. Finally, action plan has been prepared to reduce IMR from, well, this isn't really all that important. We should focus on this. Government will take necessary steps for a structural transformation of regulatory framework for medical education and practice in India. Also, there is also a proposal to amend the drugs and cosmetic rules to ensure availability of drugs at reasonable prices and promote usage of generic medicines, and new rules for regulating medical devices will also be formulated. These rules will be internationally harmonized to attract investment in this sector. This will also reduce the cost of such devices. And this is the end of the video. Hopefully you liked it. This is the first time I have made Kurukshetra in English. Later on, next month, we will try to make Yojana magazine in English as well. And for the time being, make sure to like this video and share it with your friends if you do like this. If you did like this video, and I will see you next month with next month's Kurukshetra magazine. Till then, have a good time. Make sure you study hard, and God bless you all.